Gastritis is a medical condition characterized by the inflammation, irritation, or erosion of the stomach lining. This condition can occur suddenly, acute gastritis, or gradually over time, chronic gastritis. It affects people of all ages and can result from various causes including infection, stress, certain medications, alcohol consumption, and autoimmune disorders. While it is often manageable, untreated gastritis can lead to complications such as ulcers or even stomach cancer. Causes of gastritis. Helicobacter pylori infection. The most common cause of gastritis globally is infection with Helicobacter pylori, H. pylori, a type of bacteria that lives in the mucous lining of the stomach. Over time, this infection can weaken the stomach's protective lining, allowing digestive juices to cause inflammation. Nonsteroidal anti-inflammatory drugs, NSAIDs. Long-term use of NSAIDs such as ibuprofen and aspirin can damage the stomach lining. These medications inhibit the production of prostaglandins, substances that protect the stomach lining from acid. Excessive alcohol consumption. Alcohol irritates and erodes the stomach lining, increasing the risk of both acute and chronic gastritis. Stress and trauma. Severe physical stress from major surgery, injury, burns, or severe infections can lead to a form of acute gastritis known as stress gastritis. Autoimmune disorders. Autoimmune gastritis occurs when the immune system mistakenly attacks the stomach lining, often associated with other autoimmune conditions like Hashimoto's thyroiditis or type 1 diabetes. Bile reflux. Reflux of bile from the small intestine into the stomach can cause inflammation and irritation. Symptoms of gastritis. Symptoms vary depending on the severity and type of gastritis but commonly include upper abdominal pain or discomfort, nausea or vomiting, bloating and belching, loss of appetite, indigestion, black, tarry stools, a sign of bleeding, a burning sensation in the stomach between meals or at night. Some individuals may have silent gastritis. They show no symptoms even though the inflammation is present, which is especially common in chronic cases. Types of gastritis. Acute gastritis. This form comes on suddenly and is often caused by alcohol, medications, or infection. It may cause severe pain but usually resolves quickly with appropriate treatment. Chronic gastritis. This type develops gradually and can last for months or years. Chronic gastritis can lead to thinning of the stomach lining, atrophic gastritis, potentially increasing the risk of gastric cancer. Erosive gastritis. This involves both inflammation and wearing away, erosion, of the stomach lining, which can result in ulcers or bleeding. Autoimmune gastritis. Caused by the immune system attacking stomach cells, this type can lead to vitamin B12 deficiency and is often associated with other autoimmune diseases. Diagnosis. Gastritis is typically diagnosed through a combination of medical history and physical exam, helps identify risk factors and symptoms. Endoscopy, a thin, flexible tube with a camera is inserted into the stomach to visually examine the lining and, if needed, take biopsies. Blood tests, to check for anemia or the presence of H. pylori. Stool tests, to detect blood in stool or H. pylori infection. Breath test, for detecting H. pylori bacteria using urea breath test. Treatment options. The treatment of gastritis depends on its cause. Medications. Antibiotics, if H. pylori is present, a combination of antibiotics is used to eradicate the bacteria. Proton pump inhibitors, PPIs. These reduce stomach acid and promote healing. H2 blockers, medications like ranitidine also reduce acid production. Antacids, provide quick relief by neutralizing stomach acid. Cytoprotective agents, these help protect the stomach lining, such as sucralfate. Lifestyle changes. Avoid alcohol and NSAIDs. Eat smaller, more frequent meals. Manage stress through relaxation techniques or therapy. Avoid spicy, acidic, or fried foods. Dietary adjustments. A bland diet rich in fruits, vegetables, and whole grains, and low in fats and irritants can help manage symptoms. Probiotics may also support stomach health and restore bacterial balance. Complications. If left untreated, gastritis can lead to peptic ulcers, bleeding in the stomach, chronic stomach pain, gastric atrophy, thinning of the stomach lining, increased risk of stomach cancer, particularly in chronic atrophic gastritis. Prevention. While not all causes are preventable, you can reduce your risk by limiting NSAID and alcohol use, practicing good hygiene to prevent H. pylori infection, managing stress effectively, eating a balanced, low-acid diet, avoiding smoking and other irritants. Conclusion. Gastritis is a manageable condition when diagnosed and treated early. While it can cause discomfort and impact quality of life, proper medical care, lifestyle changes, and dietary management can lead to full recovery. For chronic or severe cases, ongoing medical supervision is essential to prevent serious complications. Anyone experiencing persistent stomach discomfort or digestive issues should consult a healthcare professional for proper evaluation and treatment.